Hello, my name is Noah Brown, and today I'm going to talk to you guys a little bit about chest PT. So, what are the indications for chest PT? So, typically, the people who will be getting chest PT either have some sort of pulmonary disease like COPD or cystic fibrosis, or they're somebody who has either been in the hospital for a long time or was just operated on, and they're having post-operative complications. And weakness, etc., and they need help clearing secretions. Maybe they got a pneumonia in the hospital, etc., etc. So, the goal of chest PT is to use gravity via postural drainage as well as different manual techniques, which I'll go over, to move these secretions from the peripheral um, airways towards the central airways where they can be coughed out. For this video, I will be performing chest PT and postural drainage on the right middle lobe. So here's just a quick review of the anatomy as well as the positioning for the middle lobe. The postural drainage position for the right middle lobe is going to be the patient in quarter turn from supine and in Trendelenburg position, so the 18 to 20 degree head down position. So it's the right lung, the right middle lobe, so their right side would be up, and you can position their right arm overhead to open it up and give you better access to um, the area that you're going to be percussing. And you're going to percuss right under the nipple line, and the right middle lobe goes from about rib 4 to rib 6 or 7. So here's the sequence of chest PT. So this is all done in the postural drainage position. You start out with percussion, which you do for 3 to 5 minutes per lung segment, and it's continuous throughout inspiration and expiration. So you're doing percussion throughout their entire breathing cycle, whereas vibration and shaking are expiratory techniques only, and you perform them for 3 breath cycles. So you do vibration 3 times, breathe in, breathe out, and then you do shaking 3 times. And throughout this entire process, you should be encouraging your patient to cough to clear their secretions. So before I show you guys the video, I just wanted to give a quick disclaimer. I did do the chest PT on a couch. My brother was my patient, so some of the stuff isn't perfect. There is also the Bruins game on in the background, which I apologize for. I hope that it's not too distracting and that you can still kind of hear what I'm saying, because I think that even though some of the manual stuff isn't perfect, that I um, I explained what I was doing pretty well. So hopefully you guys can hear that. And my body mechanics are not perfect. I tried my best. I did, I think, all right, but in a clinic or a hospital that has a um, high-low table, it would be a lot better. And when I watched it again, I realized that I was percussing, at least with my right hand, a little too low for the middle lobe. So I apologize for that. But again, it's just for reference. This is not for any sort of medical advice or diagnosis. So yeah. All right. So Jake, I'm gonna do some percussion on you. All right. Shouldn't hurt. Should feel all right. And then after, we're gonna cough a little bit. We're gonna help you cough out some of that mucus. All right. So I'm gonna use a cupped hand for this, and I alternate wrist flexion extension, try and keep them nice and loose. Should sound like a nice hollow sound on his thoracic cage. So you notice that nice loud hollow sound That's what it should sound like. It shouldn't be slappy like this, because that doesn't feel good, right, Jake? It doesn't feel good. So you want to make sure you maintain the cupped hand. What I like to do is I can flip my finger under like that, so if you have the finger mobility, and that kind of pushes your thenar eminence in, so you get a nice cupped hand. See? That's nice. That's what we're looking for. Do it with my other hand. So percussion, we're doing this for 3 to 5 minutes, and we do it during inspiration and expiration. And throughout this, you should be promoting coughing if you loosen up any secretions. But we're going to say 3 to 5 minutes is up. And now I'm going to do the second part of chest PT, which is vibration. So for this, you're going to want to straighten your elbows and lock your shoulders. And that's because this relies on co-contraction of your arms to basically create an oscillatory force at your hands. And these vibration along with shaking are expiratory techniques only. So they're only performed during expiration. So they're each performed 3 times each. So Jake, I don't know if you got that, but what I'm going to have you do is I'm going to have you take nice deep breaths in, and then when you breathe out, I'm going to push on you a little bit, alright? But it shouldn't be uncomfortable, alright? Sound good? Alright, so I use a dummy hand, and then I oscillate with my dominant hand being the right. Alright, Jake. Breathe out. Alright, 3 breaths. And again, I could be sitting him up and having him cough if we loosened anything up, but I think you're doing pretty good, Jake. You don't need to cough anything up. Excellent. Alright, so now we're going to do shaking. So shaking is similar to vibration, but you bend your elbows to allow the ribs to come back, and it involves a little bit more compressive force. So, Jake, what I'm going to do is, again, I'm going to have you take a nice deep breath in, and then I'm going to push on your ribs a little bit harder, and it's going to be a little bit more forceful, but it still shouldn't be uncomfortable. Alright? Alright. Nice deep breath in. In. Alright, good job, Jake. So, we've now done the 3 techniques that are involved in chest PT, and I would sit Jake up and allow him to cough and take a look at that sputum. Thank you very much. Thanks, Jake. Thank you, Ricky, for videotaping. So I just wanted to really quickly expand on what I said in the video earlier about the hand position for percussion. So what I found I had difficulty with, at least on my left hand, was keeping that nice, like even now, keeping that nice hand position, the nice cupped hand. Forgot the word cupped. So what I came up with is using your pointer finger to forcefully adduct your thumb in, right? So it looks like a little snail. And I like that because it really makes your thenar eminence pop out, because it forcefully adducts your thumb in, and it really locks you into that nice position. So if you can get your hands there, I found this really helpful, and you get a good hollow percussion sound. So just wanted to make that clear because I know it wasn't super clear in the video where I was demonstrating it.